everyone. So the policy that we chose to evaluate is AB 617, Community Air Protection Program, presented by Rishi, Athira, Shreena, and Natasha.
The problem and consequences that AB 617 aims to deal with largely regard community air pollution and its effects. Air pollution is a massive issue within the United States, and this is the case especially in California. In fact, California's cities and counties ranked among the top 10 states with the worst ozone and particle pollution in the country, and this is due to a variety of factors, including the fact that its leading industries are in agriculture, technology, manufacturing, and aerospace. Other factors include chemicals emitted from car exhaust and industrial pollution, the weak public transportation systems, and California's annual wildfires. This has grave implications for California's population, as air pollution is associated with heart and lung problems, and in some cases, even premature death. The environment is also severely affected with increased acidification of bodies of water and changes in the soil's nutrients. Certain populations are considered at risk for these health-related illnesses, as their communities are more likely to be exposed to air pollution. Among these populations are racial minority groups who live in highly segregated communities, non-white individuals, and adults living in urban cities. The magnitude of the problem can be better understood by looking at these statistics. According to the California Air Resources Board, more than 7,200 deaths can be prevented annually with reduction of fine particulate matter, and over 90% of Californians are forced to breathe unhealthy air. Further, in 2016, researchers predicted that over 3,225 people will be hospitalized for cardiac and respiratory issues that have developed as a result of air pollution. The map to the right outlines the annual mortality as a result of air pollution in the United States. We can clearly see how air pollution most severely affects California, with California reporting the highest excess mortality rate.
Policy Solution AB 617. Passed on July 25, 2017 by state legislation, AB 617 aims to eliminate disparities regarding the unequal burden of air pollution within low-income and underprivileged communities throughout the state of California. AB 617 was designed in response to the already existing law that required the California Air Resource Board to develop a multifaceted website incorporating information regarding greenhouse gas emission and air pollutants. The details outlined in AB 617 called upon this resource board again to provide annual updates and data regarding the levels of air pollutants and greenhouse gas emissions specifically within at-risk communities. To effectively fill the requirements of AB 617, California's Air Resource Board utilized legislative grant funding to implement the Community Air Protection Program, or CAP, in a variety of local communities throughout the state. Through this program, at-risk neighborhoods have been provided the opportunity to formulate unique strategies and guidelines so that adequate data collection, air monitoring, and greenhouse gas reductions can be achieved. To implement the CAP program, California's Air Resource Board currently uses the following 8-step framework within each of its 10 targeted communities. The first step includes democratized participation, which involves the development of steering communities, which allowed the CAP program to collaborate with citizens and collectively formulate their own strategies for air monitoring. Step 2 was taking action statewide. CAP took action across the state to reduce emissions. Step 3 was local action, which included development of local emission reductions programs. Step 4 was tracking progress, which provided communities with the opportunity to track and assess the program progress. Step 5 was developed resource wisely. So this included partnering with local transportation services to reduce greenhouse gas emissions. Step 6 encouraged green vehicle use. Step 7 was data collection. And Step 8 was providing usable data. So all of the above mentioned steps will be used to design and develop improved and novel programs in 2023 to reduce air pollution in the hopes that it will eventually lead to the achievement of AB 617's overarching goal to eliminate citizen exposure to poor air quality. Here is a slide outlining the progress of AB 617 since its passing in 2017. As you can see, the results of the program will be used to formulate the new air reduction program for 2023. AB 617 Policy Landscape. Before and following the passing of AB 617, various acts have been and are being implemented to address and combat air pollution at both the state and federal levels. The first of these acts was the Clean Air Act, passed at the federal level in 1963. Since its passing, the Clean Air Act has been amended. However, its primary goal since its establishment was to mobilize federal resources and partner with the Environmental Protection Agency to develop a comprehensive national regulatory program. Such programs were required to enforce specific air requirements and ensure that national air pollutant levels never exceeded set limits. At the state level, California passed assembly bills all aimed at reducing poor air quality. More specifically, in 2019, Governor Gavin Newsom passed AB 836 to mitigate the adverse effects and worsening air quality that has resulted from wildfires. The passing of this bill required that the state to allocate funding towards the implementation of the Wildfire Smoke Clean Air Centers for Vulnerable Populations Incentive Pilot Program. Through this program, populations at risk have reaped the benefits of ventilation systems that work to provide clean air. Lastly, to complement AB 617, California state legislation also passed AB 398 on July 25, 2017. The passing of this bill extended and modified the already existing cap and trade program to improve the rate at which California continues to reduce greenhouse gas emissions.
Now let's discuss the public opinion of AB 617. Despite the promising benefits and outcomes that AB 617 holds for at-risk populations in California, local organizations and citizens have expressed their concerns about the bill, deeming AB 617 flawed and ineffective. One example is the Bay Air Quality Management District, a local organization partnered with the Community Air Protection Program, whose primary concern is centered around the state legislature's inability to provide the annual funding needed to appropriately implement the law's envisioned program. Similarly, the California Environmental Justice Alliance pointed out the following flaws of the program, stating that 1. Funding shouldn't be dependent on air pollution levels because with improved air quality, all the funding necessary to maintain this progress will no longer be accessible. 2. This bill failed to provide quantifiable, permanent, and enforceable emissions reductions. And 3. The bill lacks any specific community focus and failed to address the unique circumstances and challenges of each population in need. Although AB 617 seemed beneficial to locals, the public has reservations about its financial sustainability and ability to address the specific concerns of the target communities effectively. Next, we will be discussing the logic model. The logic model is an evaluation tool which tells us how a policy should work with 5 main components. First are inputs. These are resources needed to implement the policy. This includes funding to set up air monitoring plans, retrofit control technology for overpolluting cities, uniform statewide reporting plans, and higher penalties for pollution. Activities are action steps carried out using the resources to carry out the implementation. This is reviewing air monitoring systems every 5 years, working with community-based organizations to help analyze and reduce air pollution, and implementing fines on those who violate air pollution laws. Outputs are tangible products and evidence of completion of the activities. These are fined violators of air pollution, cities with new technology after overpolluting, local community organizations trained on analyzing and reducing air pollution, and the State Air Resources Board having data available on the internet. Next are outcomes, including short-term outcomes, which are short-term effects due to the policy, which are increases in past data on air pollution and air monitoring system setup. Intermediate outcomes are the intermediate effects due to the policy, which are heftier fines placed on those who overpollute from non-vehicular sources. Overpolluting cities have implemented technology to reduce air pollution, and data is being reported on air pollution with uniform data coming from throughout the state. Impacts are long-term impacts due to the policy. These are air pollution levels decreased using AQI as a unit of measurement, complete analysis of air pollution in cities, and new infrastructure in overpolluting cities leading to decreased air pollution.
Policy evaluation for AB 617. Short-term outcome question. Did AB 617 make air pollution data available for viewing on the internet in California, increasing public awareness for the urgency of clean air? Intermediate outcome question. Did the implementation of retrofit technology improve the outlook towards feasibility and access to accurate air pollution data in California? Long-term impact question. Did AB 617 decrease cardiac and respiratory hospitalization rates in vulnerable communities across California? Let's take a closer look at the evaluation design for long-term impact. A quasi-experiment time series evaluation would be used to assess the question. This is because randomization is not ethical within this situation where doing so may negatively impact the health of the subject. In addition, multiple historical data of air pollution-related health issues are required for the evaluation of the policy. The timeframe would be a total of 10 years, 5 years before and after, from January 2013 to January 2023. The measures would include comparison of air pollution levels of target areas before and after the implementation. The data would be collected by the EPA and California Air Resources Board. The other measure would be comparison of air pollution-related hospitalization rates and prevalence of target communities before and after policy implementation, collected by local hospitals and community health departments. Evaluation challenges. The first challenge is that we are unable to identify if positive changes in air pollution are due to the policy implementation or a confounding factor, such as another policy or public health behavior change. This is because California is a leader in environmental justice, constantly implementing policies to improve air quality, so it may be difficult to see the direct impact of the policy. The second challenge is that the policy cannot focus on all of California's overburdened communities, where only a small percentage of communities are chosen to receive attention. The last challenge is the lack of access to appropriate health data due to the time lag. It is difficult to collect data on the direct effect the policy has on the health of the community because there is no immediate impact. It takes time to see a health difference as extreme. In addition, due to the lack of funding, it adds on that it may not be as possible to see the full impact of the policy.
Here is AB 617's impact on health equity.
By aiming to reduce exposure to poor air quality, AB 617 may increase health equity as minority populations bear a higher burden of unhealthy air quality. Low-income minority communities are generally more likely to have health conditions that put them at higher risk for bearing the negative effects of air pollution. It was found that 1. Soot exposure is 34% higher for Asian Americans, 24% higher for African Americans, and 23% higher for Latinos as compared to their white counterparts. As compared to other groups, African American populations experience higher rates of asthma as a result of living in highly polluted urban communities impacted by gentrification, and hospitalizations for chronic obstructive pulmonary disease, heart failure, and asthma increase on days with poor air quality, all diseases that disproportionately impact communities of color. AB 617's specific focus on improving air pollution within vulnerable communities should help address the following health disparities.
This graph here further emphasizes the burden of air pollution that is not equally shared amongst all racial groups. In fact, it is found that African American and Latino populations, on average, have higher exposure to fine particulate matter, significantly higher than the average for exposure to fine particulate matter. Overall, the difference between exposure levels throughout racial groups stands to show the urgent need for change and immediate focus towards environmental justice communities. Open-ended question for everyone. Can AB 617 realistically reverse the damage that decades of environmental racism has done to the low-income and people of color communities in California? And thank you for listening. Here is our references.